Hello and welcome to day number 4. So we're halfway through the week, halfway through the challenge. By now, you should have a pretty good idea of some different components of your knee health, including what makes up knee health, as well as some different factors that can contribute to your knee pain. We've talked about things like the location of your knee pain, the severity of your knee pain, is it acute versus chronic? So the next thing we're going to talk about is what can you actually do about this? What's in your control? What's maybe not? And then we'll also talk just about how the medical model is shifting. In the past, there's been a certain way we've moved throughout treatment, and that's really changing, and I want you to be aware of that. So, we're going to start by talking about the old medical model. This is what we've been conditioned over time to believe is true when you have orthopedic injury, such as knee pain. So, I'll walk you through what typically happens when you have knee pain, if you go through the medical model, and then we'll talk a little bit about the new medical model as well. So in the old medical model, what typically happens is an individual is experiencing knee pain. You might schedule an appointment with your ortho provider. What's likely going to happen is you're going to have to see your primary care provider first, and they'll give you a referral to an orthopedic doctor. Once you go to the orthopedic doctor, they're going to do an assessment and likely order some images. These images could range anything from an x-ray, typically will happen first. And then after that, they might try and get some additional imaging, such as an MRI. In most cases, the images are going to come back and they'll give you some information, but imaging is not always super useful or reflective of where you're at. There's a lot of individuals who might have severe tissue damage that comes up on imaging, but they don't have any symptoms. And other people are going to have lots of symptoms, but no injury shows up on imaging. So we have to take everything with a grain of salt when it comes to imaging. It's not the end all be all. And in a lot of cases, it's not going to change a lot of what happens next. So after that, the ortho doctor may offer to try cortisone injections. And if you get those injections, they might provide relief for a few weeks to months, and then you might end up having to go back and get more injections, especially if you're not seeing improvement. If you return to the ortho doctor and you're still having discomfort after the injections, the ortho doctor will continue to offer conservative care, or may start to offer conservative care rather, by prescribing something like physical therapy. And then the patient will either see improvement with physical therapy or the patient will return to the doctor after 6 to 8 weeks. And at that point, the doctor may offer surgical intervention. So as you can see, there's a lot of different steps, a lot of different things going on leading up to physical therapy and surgery. But what can happen in the new medical model is you can skip, the first 6 steps, skip going to the orthopedic doctor, skip the images, skip the injections, and you can go straight to a physical therapist. Physical therapists are trained extensively to perform orthopedic evaluations, and you can get started with treatment pretty quickly. So it's a situation where you're saving time, you're saving money. And if the physical therapist, if you don't see improvement with physical therapy, they can refer you right back to the doctor and you can get, the imaging, you can get injections, all the same things. But if it's a situation where you start physical therapy right away and you see improvement, then think of all those steps you're saving. Think of the time, think of the money, all that good stuff. So we're trying to shift more towards a model where you go and see physical therapy, you explore conservative options first, rather than falling into the spiral that is this previous medical model where you go through all kinds of different steps that might help a little bit, might give you a little bit more information, but they might not at all either. And then you're just, again, wasting a lot of time, wasting a lot of money when you can get back to um, a lifestyle that has decreased pain and all that good stuff by just starting physical therapy first. So hopefully this provides just a little bit more insight into, the old medical model, which you might be going through right now, um, versus the new medical model. Maybe you're in a situation where you haven't tried physical therapy yet. I'd highly recommend setting up an evaluation just so you can get a different set of eyes on things through someone who's focused on conservative care, focused on helping you avoid surgery, all that good stuff. Um, and then kind of going from there, because at the end of the day, the worst thing that can happen if you go straight to physical therapy is, you don't see improvement. And in those cases, at least you'll have a little bit more information about your situation. And then you can always go back to, or orthopedic doctor. And just because you have physical therapy doesn't mean you can't receive some of these other services. And if you do go on to have surgery, the stronger you can get, the more mobile you can get before surgery, the better outcome you're going to have for your recovery. So, all the work you're doing in physical therapy, even if it isn't reducing your pain, if you're getting stronger and if you're getting more mobile prior to the surgery, it's going to set you up for that much more success afterwards. So, that's it for day 4 in terms of going over some of the different medical models, some of your different treatment options. Um, and day 5 is going to be a little bit of a wrap up. We're going to talk about what action steps you can take next. And then, oh, I cannot forget our exercises for the day. For strength, we're going to be going through a squat progression. So this is going to start with, it could be mini squats if you're having a little bit of pain with that squat motion. If you're feeling good with mini squats, you can go to quarter squats or half squats. And if you're feeling good with those, you can progress to something like a sit to stand. And then for mobility, we're working on the hips today. We're going to be doing the hip 90-90 mobility drill. I'll post it in the email if you're doing this live this week. Otherwise, you can look that up on my channel as well. So hopefully that's helpful. Any questions, any concerns, drop them in the comments. Otherwise, we will see you tomorrow for our last day.